Introduction to Portacaths. Objectives. Upon completion of this presentation, the nurse will be able to determine the type of Portacath used, order the right accessing supplies, maintain the Portacath, and deaccess the Portacath. Types and locations of ports. So first things first, determining the location and type of Portacath. Most of the Portacaths used now are the power ports, which are triangular in shape, which we'll go into in a second. Most of the Portacaths are found on the right side of the chest, but sometimes they are found on the left side. So this is an example of an older type of Portacath, which was a round port with a round septum. You may still find these types of ports used, but most have gone to the power port shown in the next slide. So this is an example of a power port. It's most often utilized, has a triangular base, septum has 3 raised bumps on it, and is the only port that you can have CT with contrast. So the power port device verification checklist. If you're going to be using this for a CT scan, you need to make sure that it is a power port. So we have the palpation of the points on the septum. We have the triangular port shape. We can also have an ID card that the patient will carry, and we can have the EMR documentation. Do not power inject for a CT scan unless a power port device has been verified by at least 2 of the 4 requirements from the previous checklist. This is an example of a power lock infusion set that may only be power injected for a CT scan when used with a power port device. This is a couple of examples of packaging. The first one is just a regular Huber needle. The second one is the power lock needle. And this is an example of the current packaging at First Health for the Portacath insertion kit. Accessing a Portacath. This is the lifeline of the patient, so we need to make sure that we are doing everything in our power to do a sterile procedure and protect this Portacath as we are inserting the line. So assessing the port to determine if it is a power port or a non-power port, we want to review the EMR if necessary. The older type of power or Portacath cannot be power injected, and this is the round with the round septum. The newer model, which is the power port, can be power injected. It is triangular in shape and has 3 raised bumps on it. First thing we want to do is discard all tubing used prior to initiation of the Huber needle. Obtain new tubing and flush with ordered fluids. Document the tubing change. We want to verify initiation of the physician adult orders for a Portacath device. So just make sure that we have an order to access this device. Obtain a Portacath kit and appropriate Huber needle. So on the left you can see the kit that we use at First Health, which is, it says Portacath insertion buyer patch on it. And then we have the Huber needles as well as the power pack needles that we use. If we are not power injecting, we can access with a non-coring safety needle. If we are power injecting, you need the power pack needle. Choose a needle length based on the reservoir depth, tissue thickness, and thickness of any dressing beneath the bend of the needle. So here you can see we have the kit says Portacath insertion buyer patch on the kit. Here I have one that I have opened for everybody to be able to look at. Remember that this is a sterile procedure, so you would, when opening this kit, you would only want to use the 1-inch outside edge of the pack. Inside the pack, you're going to find that we have gauze and we have gloves. The gloves are, I believe, a medium, so you may end up having to get gloves out of the procedure room. We have the ChlorPrep that you would use for the procedure. We have the dressing. And we have 2 masks, one for the patient and one for ourselves. We want to make sure that we ask anybody that's in the room to step out of the room while we are performing this procedure. The other thing that we have are the sterile drapes. We have 2 saline syringes. We have our biopatch. And we're going to find our appropriate Huber needle. Now make sure you don't set it on the packaging like I'm doing here, because it is sterile. The field is sterile, but the packaging is not. So we don't want to set it on the field like I just did. Upon opening the package, we're going to prime the Huber needle. So we're going to pop open the package and we're going to place this on the sterile field. We're going to inject the saline into the Huber needle until we see a couple of drops come out of the end to make sure that we have no air in the line. You should be able to see a couple of drops on the, there you go, a couple of drops on the sterile field. We're going to, after we clean the insertion site, we're going to hold the needle at a 90-degree angle and then insert into the patient. So this is just a example of what a Huber needle looks like and how it goes into the patient at a 90-degree angle. We're going to pull back 5 cc's and check for blood return, and then inject with the saline syringe and then put the dressing on and go from there. So first thing we do is place a mask on the patient and a mask on ourselves. Each kit comes with 2 masks. Ask non-essential personnel to step out of the room during the procedure in order to limit the number of masks being used and to ensure that the technique is sterile. Following aseptic technique, open the Portacath kit and apply sterile gloves. Cleanse the area with the ChlorPrep using friction with a back and forth motion for 30 seconds and allow to air dry with no fanning. I know in nursing school we were taught to go in a circular motion, but it has now been found that going in a back and forth motion is actually better. So here's an example of our ChlorPrep. It looks like the ones that we use for our IV insertion kits, except for it is much larger. We're going to pop it and then go in a back and forth motion across the area for 30 seconds and then allow to air dry and not fan. We're going to prime the Huber needle tubing with normal saline. We're going to palpate for the edges of the reservoir, locate the flat surface and hold steady. Insert the Huber needle perpendicularly 90-degree angle into the skin until it meets resistance, which will be the back of the reservoir. We want to inject about 5 milliliters of saline and then aspirate for blood return immediately. If there is no blood return present, follow the problem-solving protocol that's located in the policy. Once placement is verified, apply clamp, remove syringe, attach needleless connector cap, and attach IV tubing. We're going to place the BioPatch antimicrobial patch at the insertion site and cover with transparent dressing, label and date and time. Note that the Huber needles are replaced every 7 days with dressing changes. So the Huber needle itself has to be replaced every 7 days with the dressing change. Document the dressing change, cap change, and condition of insertion site surrounding the area in the medical record. Discontinuation of a Huber needle. Verify physician order, then disconnect the tubing and needleless connector cap from the Huber needle extension tubing and clamp extension tubing while keeping sterile. Aspirate a small amount of blood to verify placement and flush with normal saline, and then inject 5 milliliters of heparin into the port. Clamp extension tubing, remove occlusive dressing. Remove needle by pulling straight out from the port while stabilizing port by pressing down with fingers on the reservoir with free hand. Place dressing, document care, and description of site.